Patient safety over profit. Anthem reverses controversial anesthesia coverage policy. In our last video, we discussed how Anthem Blue Cross Blue Shield, Anthem BCBS, had announced a policy that would limit the coverage of anesthesia during surgical procedures as a cost-cutting measure. Here are the key facts pertaining to Anthem Blue Cross Blue Shield's decision to reverse its policy change on anesthesia coverage. Initial policy proposal. Anthem Blue Cross Blue Shield, Anthem BCBS, announced a policy change that would limit the amount of time they would cover anesthesia during surgeries and procedures in states like Connecticut, New York, and Missouri. The policy was set to use physician work time values from the Centers for Medicare and Medicaid Services, CMS, to determine an appropriate number of minutes for which anesthesia would be covered. Exceptions were to be made for maternity-related care and patients under 22 years old. Public reaction and criticism. The policy faced sharp criticism from anesthesiologists, notably from the American Society of Anesthesiologists, ASA, who argued that it could jeopardize patient safety and lead to unnecessary costs for patients. There was significant outcry from the public and on social media platforms, with many expressing concern over the potential for surprise medical bills if surgeries ran over time. Politicians and healthcare advocates also opposed the policy, highlighting issues of corporate profit over patient care. Policy reversal. Anthem BCBS announced on December 5, 2024, that they would not proceed with the policy change. The company cited significant widespread misinformation about the policy as a reason for the reversal. They clarified that it was never their intention not to pay for medically necessary anesthesia services, and the policy was aimed at clarifying the appropriateness of anesthesia in line with clinical guidelines. Official statements. Anthem BCBS issued a statement emphasizing that, to be clear, it never was and never will be the policy of Anthem Blue Cross Blue Shield to not pay for medically necessary anesthesia services. Implications. This decision highlights the influence of public and professional opinion on health insurance policy decisions. It raises questions about how insurers approach coverage limits and cost control in relation to patient care needs. The reversal indicates a potential sensitivity to public health policy issues and how insurers might adjust their strategies in response to backlash. Contextual factors. The timing of the policy change and its reversal might have been influenced by broader discussions on healthcare costs and coverage, as well as specific incidents like the assassination of United Healthcare's CEO, which brought health insurance practices into the spotlight. These facts outline the sequence of events, the stakeholders involved, and the broader context surrounding Anthem BCBS's policy on anesthesia coverage.